will be hitting the road this summer. Snacks and clothes aren't the only items you should pack. Dr. David Ruzicka with Priority Health is here to help you get ready for your next trip. Busy time, a lot of people will be hitting the road. Thank you so much for being here with us.
My pleasure, Amber. Yeah.
So before people, even get into those cars, hit the road, how can they prepare, right? What can they be doing right now to make sure they have a healthy and safe trip?
Yeah, a little bit of prevention and anticipation before you go. So maybe packing a first aid kit or a home first aid kit. Thinking about putting in some of those home remedies, the over-the-counter type medicines, maybe something for headaches, maybe something for pain, maybe something for sleep, cough or cold. Preferably, I recommend avoiding liquids because it's easier to dose that way. So tablets or caplets for adults, or maybe even chewables for children. Dose variability and specificity over the road is sometimes difficult to get to. Think about sun safety, maybe some bug safety. So whether or not it's aloe vera or some over-the-counter creams or lotions for sunburns that you may get. Bug sprays to make sure you keep the bugs off of you. And then general wound care. So things like maybe a good assortment of bandages, preferably like a fabric bandage that's going to be breathable so it can really help with skin integrity. Some antiseptic, some antibacterial creams or lotions, just to kind of round that out. Maybe even a pair of tweezers for those errant splinters that you might get, or even some of those ticks that you might see.
I know, yeah. So again, people will be spending, a lot of hours in the car, right? What can they do? What should they be doing, right?
Yeah, so long car trips are not uncommon, but we do want to be mindful of really two big things. Staying well hydrated, so you prevent dehydration over the road, and there's a tendency for folks not to want to stay hydrated because that's going to be more bathroom breaks. But those bathroom breaks are really important. So splitting up that long travel will really help prevent blood pooling from the lower extremities and really prevent things like blood clots. And it can also help with those long car trips, the backaches and the hip pain and the things like you might get from knee discomfort from long periods of time in the car.
What are some things people, can avoid common travel related illnesses? What can they do there? Because they'll be making a lot of stops, like you said, right? Those rest stops, bathroom breaks, just being around a lot of people.
Yeah, so probably one of the biggest travel related illnesses that we hear about are food and food related illnesses. So upset stomach. And so good hand washing, practicing good hand hygiene is very key. Peel it, boil it, or cook it before you eat it is also a really good adage. And then exhaustion and dehydration. Those are probably the other two things that folks would like to pack in a ton of things when they are traveling. And so, being mindful of your body and making sure that you're not getting overexerted when you are doing your activities and getting good restorative sleep. So still being kind to yourself when you're traveling.
Taking turns, right? If you can, driving.
Yes. Or take turns when you drive.
Yeah,
you bet.
Sure.
Yeah, for sure.
Dr. Ruzicka, I want to ask you, what are you seeing this summer so far when it comes to illnesses?
Yeah, so we had a late season respiratory condition called metapneumovirus that was kind of endemic in the communities. I mentioned tweezers for those ticks. We're seeing a preponderance of ticks and tick-related type illnesses, a very common question in the offices lately.
Okay, so there's one more thing we want to talk about. Some smart ways travelers can use their health plan benefits during the summer trips.
Right, so this would be, plan ahead and think about your benefit. You can imagine how challenging some health conditions can be when you're local. Like, where's your local ER? Where's your local hospital? What's the proximity to you? But think about what that would be if you are traveling remote. So if you're out of your own state, if you're out of the country, so say you're in Paris or Rome and you come down with an illness, what do we do in those instances? And so Priority Health has partnered with a couple of organizations to help repatriate folks, to help get them back to the United States to trusted care services. So we recommend giving a call and seeing if a plan like that is appropriate for you.
Great, thank you so much. Very helpful, Dr. Ruzicka with Priority Health. We appreciate your time. All right, Sarah?